Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Friday, the 25th of September. In today's edition, we're going to take a closer look at testing. Now, our top story, an incident in the capital has forced a rethink in the testing protocol. What happened was that 1,400 symptomatic patients tested negative but were not given the RT-PCR test, which was the protocol. Now, after that, on Thursday, a notice was issued to all government departments and all districts that this should not happen again, that simultaneously, instead of waiting for the antigen test results to come, simultaneously the test should be done for everyone who is symptomatic, so that there is no chance of a false negative person going ahead and infecting others. Now, as we've been pointing out, there is a heavy reliance on our rapid antigen tests by several states. Delhi, in fact, has 80% rapid antigen tests instead of having a larger number of RT-PCR tests, which is the gold standard of testing. So 81% here in Delhi. UP and Bihar are the other states which are also heavily reliant on rapid antigen tests as well. And this incident, which took place in Delhi, where 1,400 people, who many of them may have had a false negative, didn't get to take that rapid antigen test. So this has got alarm bells ringing. And of course, one of the things that the government's trying to do is also to ramp up the testing laboratories for RT-PCR tests, because at the moment, if you go by the capitals, they are testing about 10,000 RT-PCR tests, but the maximum that they can do is also 11,000. So in order for the states to rely more and have more RT-PCR tests, you also have to need more labs. Now, that's not the only thing. In our second story, what we have is that this week, for the first time, the government shared district-wise data of testing. And here's what they show. It showed how it's distributed in rural districts, mixed districts, and in urban districts as well. What is the testing procedure there like? Because remember, one of the things that the WHO and other health experts say is that in order to contain the disease, you have to test more and then isolate those who test positive. So it shows that for rural areas, which has 74% of the population, there are 65% of tests being done, whereas in urban areas, which has 14% of the population, 22% of the tests are taking place over there, and 28% cases are emerging from there. Now, the positivity rate is interesting because it shows that in urban areas, the positivity rate is much higher. Perhaps that's understandable as well because of the population density. It is 10.5% in urban areas, 6.9% in rural areas. But this data shows that it is growing, and both those places, rural and urban, is much higher than what is prescribed by WHO as acceptable. They say that if the positivity rate is 5% or lower, it shows that the disease spread is under control. So at the moment, it's not under control either in rural or in urban areas in India. And also what's interesting is that we are seeing a variance in positivity rates within a state among districts. So for example, and what's interesting, and this is really important over here, like we would think that in rural areas, because people would be spread out, people won't be packed together like in the cities, you would have less spread. But in Maharashtra's rural districts, for instance, Nandurbar, they have a positivity rate as high as 48%. So that's interesting. So that's a rural district, Nandurbar. It has a positivity rate of 48%, whereas Delhi, which is urban, has a positivity rate of 7%. So we can't assume that just because it's a rural area, it's going to have less spread. So that is a significant takeaway from this. Our next story, of course, is a study that comes from Brazil, which gives us an idea of how much herd immunity, how many people have to be infected in order to attain herd immunity. What's interesting is this study, which is from the city of Manaus, which has a population of 2.1 million. And we saw rapid spread and lots of deaths in that city before it slowed down. Now, the study showed that and that's of the antibody analysis, it showed that 44% to 66% of Manaus in Brazil had been infected. So it seems that figure is enough for herd immunity, because the infection rates and the daily cases has really gone down in that city. From daily deaths of 79, they've had 4 deaths in the past 2 weeks. So 44% to 66% if we take the lesson from Brazil. And now, of course, the city is emerging from a lockdown. So very key over there. Remember, we're getting to know new things about the disease every single day. And finally, back home, things getting back to normal, or trying to, and the economy starting up. A major part of that is, of course, the Bollywood film industry. And next month, many films start shooting. This includes Akshay Kumar's next film as well. Of course, producers point out that COVID restrictions mean that a significant chunk of their budget, or their budgets, are going to rise, because they're going to have make major adjustments to live with the coronavirus. Those are the news updates for now. Keep tracking them on HindustanTimes.com.